Good afternoon, everyone. My dear friend, the Honorable Minister of Health, Dr. Jane Ruth Chang, if you will permit me to stand on all protocol duly observed. You know we Americans are not real big on protocol. So it really is wonderful to be here and to see such a full room of very smart people. You all make me feel very unsmart at the moment. But I really had no choice when I received the invitation was asked to come and participate in this celebration of 25 years of public health training at McCary University School of Public Health. I had to say yes. Those of you who know me know that I spend a lot of my time working on public health issues, although I am not a public health professional. But I am constantly amazed and impressed by all of those wonderful and talented public health professionals I have met here in Uganda in the nearly 4 years that I've been here. I'm also very happy to have the opportunity to be here and to note the wonderful partnership that the U.S. Centers for Disease Control and Prevention have been with McCary University to really help grow public health training here in Uganda over the last 25 years. At McCary University, public health training, and indeed through CDC's permanent country presence in Uganda, this all started out, as you know, and you've heard already from many of the speakers, as a collaboration between the Ministry of Health, McCary University, and the Centers for Disease Control. And as I've learned, as I was educating myself before I came here to speak to you, the School of Public Health has graduated over 600 professionals with degrees in public health. And as I know well, and know firsthand from working here in Kampala and traveling out to the districts across the country, that many of these graduates are currently serving in middle and top level positions in public health leadership, academia, research, and doing community service here in Uganda, in Africa as well, and also globally. Skilled public health professionals are really critical to effective public health response and indeed to improving the health of the entire global population. And as we heard from the WR, the focus on global health security, not just locally, regionally, but globally, is something that is gaining increasing importance and attention around the world as we watch disease outbreaks, how quickly they can spread, the impact that they have, not just on personal lives and livelihoods, but on economies and countries. Since its inception, this program has received and continues to receive technical and financial support from the United States government through CDC. In the early years, CDC provided seasoned epidemiologists to provide technical assistance for establishment of a successful MPH program in Uganda. More recently, CDC, through a cooperative agreement, has supported experiential learning through the funding of MPH field attachments, surveillance training, and participation in outbreak investigations. These are just some of the many contributions that the U.S. government has made just to the MPH program. As you know, and as you heard, the U.S. government, through other mechanisms, through USAID, has provided funding early on to help create and drive some of this work as well. We fund other research through our National Institutes for Health. So while CDC is the key partner for the McCary School of Public Health, we know that the U.S. government is engaged in many, many ways in a partnership from top to bottom in the public health sector here But it really only makes a difference because we have such wonderful partners, such as we find at McCary School of Public Health and across the country. So thank you for being such wonderful partners to us. The U.S. government is committed to supporting good public health practice at all levels of healthcare. MPH training has been key in developing a pool of skilled public health practitioners with capacity to offer public health management and leadership to respond to public health emergencies in Uganda and across the continent. Some graduates were called upon to participate in Ebola response efforts in West Africa, where I experienced their work firsthand in Liberia when I was serving there as ambassador during that epidemic. And they continue to support ongoing efforts in the Democratic Republic of Congo. To institutions that have passionately supported public health training, like McCary University and CDC, it continues to be a real source of pride to see the graduates contribute to public health practice that benefits the entire population. And I remember still having a very interesting and wonderful conversation with a young Ugandan who responded to the Ebola epidemic in Liberia out in the countryside, who had been posted out in a relatively difficult area of the country, who was out enthusiastically walking from door to door within the villages to explain to people what they needed to do to help them understand, to gather data to help us understand how the epidemic was unfolding in that particular county in Liberia. At the time, he had no idea that I would be coming to Uganda, although I knew that I would be coming within the next year or so. But I was absolutely amazed to listen to how well trained he was, how committed he was to what he did, and how inspirational he was to Liberians who looked at him and said, we want to be able to train people like that. We want to be able to develop that capacity. And I'm not sure that he really understands exactly what kind of legacy he left way on the other side of the continent. But it's just a testament to the capacity that exists here in Uganda, a testament to the great education and training that McCary School of Public Health is providing. And we're proud to have been a part of that through the various programs that we have helped you help to support. The U.S. government also supports public health training and development through CDC support for the 2-year Public Health Fellowship Program, or our Field Epidemiology Training Program, which produces public health leaders for key positions in public and private sectors who are skilled in surveillance, outbreak investigations, program evaluation, and data analysis for decision making, thus training professionals with the potential quickly to respond to new and emerging disease threats and outbreaks. These disease detectives increase our ability to identify and respond to threats. In a world where the next outbreak is only a plane ride away, disease detectives help countries identify and stop health threats close to the source, both those that we anticipate and those we don't expect. And the School of Public Health is a key partner in this postgraduate program, along with the Ministry of Health and CDC. So let me close by simply saying congratulations to McCary University School of Public Health as you celebrate 25 years of the MPH program, and reiterate the U.S. government's continued commitment to work hand in hand with the people and the government of Uganda to deliver evidence-based and quality health services, to strengthen health systems, and enhance partnerships to improve the health of all Ugandans. We sit at a very critical time globally in terms of what will happen as we move forward with emerging diseases, and even ones that we know and where they will come and how we will fight them. And we sit more locally and more immediately in the middle of a continent where, as you all know, we have Ebola still in eastern Congo, that we are all having to constantly remain prepared in order to respond. The good news is, as I talk to my colleagues from across the region, I have a sense of comfort that many of them do not have. And why is that? It's because I know I have confidence in Uganda's capacity, demonstrated by all of you here and the other graduates who are out there, Uganda's capacity to respond, to prevent, detect, and respond to these outbreaks. And so it helps me sleep a whole lot better at night, and I try to convey that constantly, that not that we cannot be vigilant, we always must be, but that I know that thanks to places like the School of Public Health, in partnership with all of you and others, we are able to do our little part in this part of the world to ensure public health locally, regionally, and globally. So thank you again. Congratulations to the School of Public Health, and we look forward to continuing our partnership. Thank you.